What's up, guys? David DeSell here, your host of the Business with the Boys podcast. And we just recently got off a podcast with someone who I think you'll really enjoy. He's in a profession that both Landon and I subscribe to, which is concierge medicine. It's a different take on healthcare. It's also someone who was in the hospital system that has since gone out and started his own business and is having a lot of success in doing so. So in this episode, we spoke with Dr. Todd Johnson, and he started his medical career in Des Moines, Iowa, at Des Moines University. And after his residency in the Michigan State University system at Traverse City, Michigan, he started practice in Lincoln, Nebraska. He did join one of the major healthcare systems, as I mentioned. And really, over the course of his 13 years within that system, he was groomed into physician leadership positions, including practice, medical director, patient-centered medical home physician champion, and quality medical director for the physician network. But after 13 years of working within the system, Dr. Johnson did the unthinkable and decided to actually jump off the ship. He went against the grain, started his own private practice with a completely different business model. He started Nebraska's very first direct primary care, a membership-based medical model that does not bill insurance at all. All of his members pay a monthly fee to have access to his services. He does not bill a copay or charge a dime for office visits. Also included in the services are communications via cell phone, text messaging, and email, all for the convenience of the patients. And for those of you who haven't experienced this with your doctors, it's amazing. His model continues to expand, which also includes wholesale discounts on prescription medication, laboratory services, office procedures, and durable medical equipment. He continues to add high quality services at a valued rate by negotiating prices with community members for outpatient medical services, including consultations with specialists and outpatient testing. Dr. Johnson has also started to build a model for cost-effective surgeries for his clients as well, and he speaks to that in the episode. The guiding purpose of Access Family Medicine, which is his company name, is to preserve the patient relationship while creating an affordable healthcare experience. Access Family Medicine is passionately committed to investing the necessary time to develop strong relationships and create unique healthcare experience based on integrity and transparency. Access Family Medicine caters to the medical needs of individuals as well as small businesses, which is a cool model, and their employees to create a healthier community. So without further ado, let's jump in and learn from Dr. Todd Johnson.
Whoa. Who knew I would make it this far? They hated, they never believed me. Yeah, I would never drop the ball. I know I make it look easy. Yeah, Mayweather with the defense. I don't care what a critic got to say. I got them picking up the pieces. That me, you really playing with your life. I'm about to come and run it all back.
Dr. Todd Johnson, I am fired up to have you on the show. It's been a long time coming. We've had some scheduling issues, on our end. So appreciate your patience with us. And as I said, when we first got started, ironic that we're recording today because I just had my annual physical with my concierge physician. So welcome to the show.
Thank you very much. It's great to be here.
Yeah. So walk us through basically get kickstarted. You are a concierge doctor, in which Landon and I are both very big believers in. But walk us through a bit of your backstory, why medicine in the first place, and what ultimately led you to the concierge model.
Right. Good question. Well, lots of backstory. I'll try to keep it, brief, but I'm one of those people that, I knew in ninth grade that I wanted to be a doctor. Well, let's take that back. I really wanted to be a professional football player, but we knew
Don't
the
we all?
likelihood of, yeah, we all did, right?
I'm
But
laughing
I
because I
needed
know your stature. You're well put together, but your NFL would be tough gig for you.
exactly. Yeah, right. There are a few guys my stature that have made it, but not many, and they run way
Not many.
faster than I do.
Yeah.
So, So I needed a backup plan. So because my first plan was high reward, low likelihood. But anyway, I knew I loved the sciences, and in ninth grade, I knew that that's what I wanted to do. And when I graduated from medical school, my sister said, "You're the only person I knew who went to college, knew what they were going to do, and actually did it all the way through. So undergrad to grad school to medical school and graduated." So I just had that burning desire at a young age. That's what I wanted to do. And being an athlete, I thought orthopedics was going to be the thing for me because that's all I was aware of. You twist an ankle, you go see, you don't see your primary doctor, you see your orthopedic doctor, and thought that that's what I wanted to do. Ultimately, in medical school, I had the opportunity to learn about all the other specialties that are out there. And I had a terrible time trying to focus and try to concentrate on what did I want to do, and because I liked everything. If I was on neurology, that was the best rotation ever. If I was on pediatrics, that was amazing. I had no idea how much fun that could be. And I was in rural Iowa on my family practice rotation. And what I really learned is I could do everything. I could do as much orthopedics as I wanted to, short of surgery. I could do as much pediatrics I wanted to, on and on with all the subspecialties. And, it was about that time that I had to start to decide, hey, where am I going to apply to residency? And my wife said, "You reek of family practice." And I looked at her and said, "What do you mean?" She's like, "You would be so bored doing the same thing, the same four disease processes all day, every day." He said, "You love the variety. This is just what you're made for." And it was that come to Jesus moment. I'm like, huh, I didn't see that one coming. So anyway, I got into family practice, and she's right. I love the variety that every day my schedule is different, and there's fun things on it, there's challenging things on it, but it's never the same. But fast forward, I trained in my residency was in northern Michigan, and I trained in a rural setting on purpose because that's how you get to learn to do lots of different things in the primary care world. And let's face it, if I trained in Omaha, I would learn how to write referrals to other specialists in the area, right? And Omaha's a small big city compared to if I was in Detroit or Philadelphia. It's the same thing. So I went rural on purpose so I could learn how to do all these things. Ultimately ended up in Lincoln doing family practice with one of the big hospital systems. Worked there for 13 years and was groomed kind of at a young age for some leadership opportunities and was looking at some model redesigns, how to improve efficiency in the practice. Efficiencies make more money with less effort, uh, doing more with less, all of those types of things. And we had, varying degrees of success with different models. But in that process, I realized the big thing is the patients that we're taking care of were probably missing out. Our model didn't work for the patient, and I got into this business to help the patient, not the model. And it just bothered me, and it just kept going on. I'm like, well, no, just keep your head down, just keep working. It's going to work out. It's going to be fine. But the longer I went through it, the longer I realized I can't just ignore these people that the system doesn't work for, and the people who are falling through the cracks. So, I just kind of kept my eyes and ears open with regards to different practice models and things that might pop up. And I was super busy and didn't have time to answer all my emails, as most of us know. And you guys hear about how we slam through the day seeing 25 or 30 patients, then we go home and do paperwork for 3 or 4 hours. Well, that was exactly the case. But one day, I remember this clearly. I had a no-show and I was caught up, so I wasn't working through my backlog. So I was, thumbing through some emails, and this email popped up about this new practice model, and it was a model that was becoming very popular, and this is how it works. And it kept popping up, and I was hoping that karma would take effect, so that if I just open this email, it will stop popping up, right? If I just look at it, it will stop annoying me. Well, I popped it open, looked at it, and I stopped and I paused and I thought, this stuff has some potential. There's a reason it continues to pop up. So I went home and I tried to describe this model to my wife, and it's hard to describe at all, not to mention the first time through. So I always tell
What, Todd, real
all
quick, what year would this have been?
this was probably 2015
Okay, so this would have been before this. Yeah,
before
yeah.
this
This
transition.
was an early adopter of this strategy.
Completely. Yes, completely. So, no,
I mean,
nobody in
10 years
Nebraska
ago,
was
there wasn't any concierge docs running around.
correct. Yeah,
Yep,
correct. If there were, they were for lifestyles of the rich and famous, LeBron
yep.
James and Warren Buffett, but that was it. And, I'm sure their doctors aspiring to do that, but never knew how to break into the system, right? So this popped up, and if you know anything about medical conferences, they're all very expensive and they're very far away and exotic, wonderful places. Well, this conference was like $200 in Kansas City. So so I
Sign me
told
up.
my wife, yeah, I said, worst case scenario, this is going to be a fantastic long weekend date, and the conference is a flop, and now we know we can move on our way. But obviously the opposite happened, and we went in there, throwing away all the rosy colored glasses. We're going to ask all the tough questions. We're going to kick all the tires. We're going to be the interrupters when we go there. And I sit down at the table, for the first meeting, and there's, three or four other people, a practice administrator, a guy that looks like he should have retired 5 years ago, and another young buck just right out of the system. And they're all kind of telling their stories. And the old guy, he's still practicing, even though he probably should have retired. And he leans over to me. He says, "Be careful when you're here." I'm like, "Be careful? Why?" He said, "You just might like it." So that was my introductory. And so again, I asked all the tough questions when I was there. And
So
again, my
who
wife is
was
always
heading up
my
this conference? Was it just somebody that had already taken the leap of faith and was doing the concierge stuff?
yes, yes. And trying to introduce this model and this concept to a broader panel of family practitioners and primary care people, and break the ice and try to eliminate the fear that's out there that it can't be done, and demonstrate how it can be and how it's working when it was out there. So we left thinking, this isn't the perfect answer. It's not the panacea for everything, but it has more answers than the current model does. And I think we actually have some solutions for the things that aren't going well. How can we fix the rough spots in the road? And to some degree, a lot of these guys are still trying to build the airplane as they're flying it, right? They're clearly having success and they're making progress, but it's not perfect model just yet. So anyway, after we kind of looked at each other like we gotta dig deeper now. That has our attention. We asked the tough questions. So we spent the next 9 months, calling individual practices across the country and visiting with them. And they're kind enough to give us their time and attention, on their own time. And we would take field trips. We drive down there and spend a morning or an afternoon with them. And again, ask the tough, granular, detailed questions because we were past the high level stuff at this point. And then we had to have that heart to heart conversation. Are we going to go forward? We can do this, yes or not? And met with attorneys and all the things you need to do to set up a business that we get zero education on in medical school, and probably for a good reason, because we're way better at being doctors than we are business people, but we still need to know who to call and who to contact to get these things done. So we went through the whole process, figured it all out, and it was decision day. I had to make a decision: are we going to do this or are we going to not do it? And I wrote my letter that I was going to take to my chief medical officer and to my partners at the office, and just say, hey guys, this is what I'm thinking. And I looked at my wife and I told her, I can't do this. There's too much at risk. I mean, I'm a sole provider for you guys, my whole family. I mean, this is a tremendous risk. And I had no idea. I thought it was risk, but I had no idea how big it was. And she looked at me and
Probably a good
she's
thing you didn't realize how big it was.
correct. Correct. And people reminded me of that, over the last 10 years. And I just had no idea how big it was. I just had complete trust and faith that it would work. But my wife, really, she gave me a swift kick in the butt and said, "You'll be great." He said, "Worst case scenario, you're going to bounce. And who else in this in this community wouldn't take you back because you had the courage to even try. Um, so yeah, looking over that ledge, it's steep and it's long, but yeah, we went for it and we
Um,
decided to do it. And, the whole goal and the purpose was, to bring the relationship back into healthcare and spend time with our patients and meet their needs on their healthcare journey where they are and
God
break
forbid you get
and
to know them.
correct. Yes.
well,
Yeah.
that
Because the
that
current
leads
model
me.
doesn't do that.
No, it
Well,
doesn't. You don't have
I
time.
I do want to talk about that, and we believe in it so much that I brought my tax write up. I mean, my child in in with us. She has a concierge pediatrician that actually goes as far as to like come to the house for the appointments, and it's uh, and going to my concierge pediatrician, Dr. Tommy McElroy. What I love, and sorry in advance, Todd, if this gets your phone to blow up on Sundays, but like even if I call or text him or email him on a Sunday, like he gets back to me within 5 to 30 minutes max. Um, and my understanding, and I'd like you to speak to this, when you're in the hospital system, let's say, you're juggling thousands of patients. Like you said, seeing 25 people in a day. Um, Talk to us about the differences between how many patients you would have in the hospital setting versus how many you have in a concierge setting that can then, glean some light as to why you have time to build a relationship and be communicative with the people you serve.
Absolutely. That's a great question. In the traditional medical model, the numbers are you need to have about a patient panel of 2,500 just to make it work. So you you do have people who are experienced and they grow their panel and it will get bigger and bigger and bigger, but it decreases the opportunity for that patient to see that provider down the line. That's just to succeed. My panel is a little bit on the larger side for a direct care or a concierge model. I have 600 adults and about 200 pediatric patients in my panel, so about 800. So about a quarter of what it would be otherwise. So you're right. With that being said, every one of my appointments is 30 minutes minimum. I will build in more time if I know they need it. It's no longer one problem, one appointment type of situation. Bring in your laundry list. Let's try to hammer it out. And if it's 8 problems, okay, we may not get all 8, but we're going to do our best to get through it. Let's prioritize this. And so we do have time in the appointment with our folks, but we have time outside too, because a lot of these text messages and emails and questions are pretty simple. They're pretty easy. And to be respectful of the patient's time, they don't need to take time off of work and sit in my waiting room for 3 hours to ask that question. They can send a picture of their rash and we can give you some ideas of what it is and take care of it. So yeah, I do the same thing. So my phone is on 24 hours a day, 365 days a year, and I'm answering text messages and pictures and emails all the time. Now, I'm not tied to my computer either because of that relationship. I have that conversation with my folks. Say, hey, if this is an emergency, by all means, you let me know and you tell me that. If it's just, hey, I have a question, I'm concerned, I don't know what this is, that's fine too. Let me know. But here's another way you can reach me so it doesn't wake me up at 2 a.m. or interrupt another patient appointment that we have going on. But I promise you, we'll get back to you. So you're exactly right. And people love that concept. They can get their questions answered, ultimately, hopefully avoid an office visit or an urgent care or worst case scenario, the emergency room because they were just scared and didn't know what else to do.
Do you feel like when you made the shift,
Mm-hmm.
because my doctor said he experienced this. I wonder if it's universal or just in his instance. But when he made the shift, his colleagues and peers who were in the hospital system, uh, A, thought he was crazy, B, sort of like started breaking their relationship with him because he was like going against the norm. My theory is that it's because he had the courage to actually break out of the chains, so to speak, and it manifested in the form of not so good reactions with the people around him. Like, what was your experience and the people around you, um, colleagues and whatnot, in that transition?
Yeah, great question. My closest friends and colleagues were very supportive, but probably equally interested to see how it would go.
That's what I was gonna say. I think they were probably like, "Ooh, let's see how this ends up," right?
Yes, that's
Can you pull this
exactly
off?
right.
Go be the guinea pig.
Right, exactly. Change is great. You first.
Yeah.
So, so I don't think I burned any bridges that way and broke relationships, so to speak. But everyone was just really curious and interested on the outside, looking in. Um, I have helped several other folks down the road establish their practices across the state. So that's been exciting and helpful for everybody. But I kind of went the next step and I reached out to a lot of my at least specialty colleagues, not necessarily the primary care folks. I try to keep touch with them, but they're just more curious how things are working because they know what their lifestyle is like and wondering what mine is in contrast, right? So, but the specialists, I'm trying to pull them in as well, and I just ask them, hey, do you guys know what I'm doing? And most of them have a very loose idea because there's two ways that this concierge and direct care model can work, right? Number one is, and I tell me if I'm wrong from your perspective, but people can think you're just skimming the gravy off the top, right? You're going after the people who have the money and are willing to spend it. Or
And
what
but
we're
if you
trying to
are,
do,
who cares? Right? Like, I mean, seriously, like that's something David and I can afford to do. Like I'm willing to pay for convenience, Todd. Like,
right?
so I wouldn't hide behind that. I'd be like, yeah, what's wrong with that, right? Like my services are like there's a reason I work with certain level of business owners, right? Like you you can't justify hiring my team and I at a certain point, and I'll tell you that, right? Like that's okay. I don't know, that just bugs me when people are like, it's like the easy way out. It's like, well, you know,
Yeah.
people are
Do
willing to
something
pay
else
for
then. Do it differently,
convenience.
right?
Yeah,
Yeah.
yeah.
Yeah. Yeah. Exactly. So, and the other way to look at it is, okay, if you're really truly being fundamental and altruistic and trying to solve some problems with our current healthcare system, you know, and breaking down some barriers. So anyway, I visit with some of our specialists and I ask them, hey, would you be willing to partner and help us out in what we're trying to do here and create access and convenience and affordability in healthcare and still take good care of people without without necessarily giving such a deep discount. No, you're giving your services away because I'm not asking for that. I'm saying give us a fair price for a consultation and for procedures that you do. These people, I'm going to train them and educate them and talk to them so you don't have to, and they're going to come in and pay cash for your service. In exchange, I know my patients getting good care because I know the quality of work you do. So we've been very fortunate being able to build that up. So I think to answer your question, Dave, that has helped keep that positive profile on our practice and what we're doing in the community. In
I
fact,
look
just
at
yesterday, yeah, go
Todd,
ahead.
the first time I met my concierge doc, I legitimately think I was in his office for at least an hour and a half.
Right?
I mean, before that, I spent an hour and a half maybe in a waiting room, but a damn sure wasn't talking to the
Yeah.
doc. You know what I mean?
Not it.
Like
Yeah,
it was almost weird. I was like, holy shit, he's asking me about family and like my, dad
It
passed
felt
away
like
last,
it felt like
family
a
history.
discovery meeting that you
Yeah.
would run getting to know
Yeah.
someone.
Which I'm like, that's the way this shit should be when you're dealing with someone's livelihood and their health.
correct. Yeah, exactly. Yep. And that's not uncommon. That's what we try to do. Yeah.
Yeah. I
And
mean, it's not that way every time. I don't want to freak people out. And now it's, I never have to see him, right? Because it's just a text or a quick call. Like, that's the beautiful thing about it. But got to know me up front, kind of wanted to know my thoughts on vaccines, everything else. I was like, I'll make things very clear for you real quick, on all of that. But it was like I'd never even had a doctor ask me about, how I felt about any of that before.
Right. Yeah,
And,
exactly.
and you were
Yeah.
going to say, Todd, you were about to say earlier today or just yesterday, you were going to go into a story.
Oh, so yeah, we have a younger patient who has some difficult healthcare situations. And he said, "Hey, I just want to let you know I visited with our county medical society and they're raving about you." I'm like, "They are? That's awfully nice. Why? What are they saying?" And he said, "You are actually taking care of the people who would otherwise fall through the cracks." And they don't have another, they have some systems in place, but they're band-aids, right? They're not fixing the problem. They're given, episodic, care. Um, so hearing that, from a guy who didn't have to stop and talk to me about this, the message is getting out to those other folks in the community and the other medical societies. So that's the warm fuzzy you like at the end of the day, right? That your colleagues respect you for what you're doing.
Well, and what else? So we've talked about sort of the logistics, different patient sizes. We've talked about communication. We've talked about, more intimate time and getting to know each other. Like, what are some other differences when someone experiences the concierge model compared to the hospital system in terms of the approach to care?
Yeah, my sister-in-law actually probably said this the best, recently. She said, all of our providers, our doctors talk to us about, we want to do prevention, we want to be proactive. She said, but they all ultimately, I don't want to offend anybody. There's just not enough time to do it because the visits are short. The system doesn't allow for it.
You still have a
And I
business
think
to run.
correct. And the traditional model is built on volume of office visits. And it takes time to do what we're talking about, to build that relationship, to get to know the patient's history. And when the average office visit is 7 minutes of face-to-face time, you just don't have the time to do that. So, we dedicate the time, like you said, Landon, up front to create that relationship, which helps us be faster on the back end when things do happen. I don't have to take the time to get to know you and figure out your health history when those things come up. And my patient panel is smaller. So, when I get the text message, I'm like, "Oh, Landon, what's going on? Are you in town this week? Or are you in? I thought you were in Texas." You're like, "Nope, I'm back, but this is what's going on." So we have time to know each other and again expand that history to family history and personal history and sometimes just like you said, Landon, personal beliefs. What is my goal? What is it I want to do? In the traditional model, we're kind of, we have the burden of documentation, we have the burden of the electronic health records, which are burdensome and time consuming. We have the burden of volume. Um, and to get it all done, it's hard and to fit it into the time frames. So for us, we carve out the time. We have the luxury of time so we can make it convenient for our patient for the first time ever. We can be transparent with our pricing and say, "Hey, if you want this test done, we can do it. This is the price." We don't have to ask for permission from the insurance company, whether it's covered or not covered, if we're in network or out of network. If you want it, we can just do it and we can answer your questions. Um, I'll give another quick example. I have an elderly couple who had to visit with a cardiologist. Great cardiologist, gave fantastic care, but when the patients came back, they were confused. They had no idea what he was really saying. And it's not a language barrier. It was a speed and processing the information. So I took the time and said, "Okay, I have the note here. Let's review it. This is what they recommended. This is what you should do. This is the medication that they offered." And they said, "Oh yeah, that medication, that was $400." I'm like, "Okay, is that too much?" And they said, "Well, yeah, I don't want to pay 400." I'm like, "Okay, we have other options. It is the best medicine you should be on, but we have other options." And the specialist doesn't have the time to filter through the weeds to figure that out. So I made some suggestions and said, "Okay, well, let's try this medication. If you want to call him and let him know that this is what you're thinking." Um, so they both stopped and looked at each other and said, "Will you come to my cardiology visit with me next time?" So I said, "Unfortunately, I won't do that." but I will get his note and I will review it with you in, together for sure. So that's not a problem. But like you said, the no-brainer is we're more affordable than the traditional model. That's even factored in if you already have an insurance product for the catastrophes and the big things that are going to derail your health and really your risk and your finances. Um, but there's that convenience and that peace of mind with that relationship that you guys have already alluded to. That it, is that satisfying. What makes is a deal breaker? What makes it worth it? So that's what we're really seeing.
Well,
At this point.
if you can also speak to, I forget the example exactly, but I was basically, going to pick up a prescription, and my doc was like, two things. Don't tell them that you have insurance. And also, I think it's Good RX. He goes, download this app, and they ran it up, and they said the price was, I think it was like $170. And I was like, oh, just so you know, I don't have insurance. This was at CVS, and you could see them like visibly annoyed. And then they changed it, and then at that point I was like, I'm just gonna make them go one step at a time. And I was like, and Good RX, and that same prescription that with insurance, which is just ass backwards to me, that was $170 came out to like $33 or something egregious like that. Um, I'd like to have you speak to that in more of an overarching way in conjunction with, when you get your blood work done, your cholesterol, and all the different panels that you do every year. They have like the, in range, out of range, or green, yellow, red. And, there's some things that, are red that look scary. And he's like, no, just so you know, like from a cholesterol standpoint, like you're right where you should be. Over the years, they've decreased the range to increase the amount of prescriptions for, cholesterol medication. So can you just, if you have one, put your tinfoil hat on and kind of share with us your thoughts on why that system is so messed up?
Yeah, I don't know if I have a good
We'll be
answer
here
to
all day.
right to why it's messed up, other than because it can, and it
And
just it
money.
just yeah, people have businesses, companies have the opportunity to do that, but it is very frustrating. What we have done in our practice is we've opened up our own pharmacy, so I dispense medications right out of our own practice, and my number one goal is to beat the local store, all the local pharmacies. And number two is to beat Good RX. So if I can even beat Good RX, I'm going to do it. And what I've learned is 80% of the time I can, and about 10% I can't. And what I've learned about Good RX is the pharmacies themselves aren't necessarily selling that product at a discounted rate that they're still making money. They're just trying to sell it lower than their competitor to bring traffic in the door. So some of them are actually loss leaders. But if you come into their store for that one prescription, hopefully you're going to fill your other five there too, and you won't get that discount.
You probably will, yeah.
Right. And because of convenience, again, I'm not going to go to three or four different pharmacies. I'm not going to take the time to call them all and wait in line, et cetera, et cetera. Yeah, the reason for the cost of medications, I don't have a good answer. I think it's just part of, politics and big pharma, and they're doing what they can, or it's just the way it is, right? So what I've learned in this model is that we can actually break out of that system and do something a little bit better. And I give people their drugs right from our office. I know that's a better price than what they would get next door, at the local pharmacy. And I use GoodRx if I need to, but again, 80% of the time I don't have to. I gave an example of a buddy of mine. He had a little, skin cancer on his scalp, and needed a certain medication for it, and it was like $2,300 through his insurance to get this covered. Again, part of it is the medicine doesn't necessarily cost that much, but it was not an authorized product for his insurance plan, so
That's
it
always
jacks the
my
price.
issue.
Yeah,
Yeah.
yeah. So I looked it up. I got it from, our same wholesaler, the same wholesaler that all the other big box pharmacies use. And I got it for him for $38. So from 2,500 to 3,800, 38.
That
And it
tells me
was
the
actually,
system's broken.
yes, yes. It doesn't, well, if you know the other countries, England and Japan and Canada can get these products for this price, it's not the cost. Um, So that's again one of the other variables that we throw in that I think attracts people is that we're going to be transparent with our pricing, and we're going to one of our core values is we're going to work hard to provide you the best price possible. Sometimes those prices aren't low, but it's still the best price possible, and help people out as much as we can. So we've learned that a couple of things. Number one is if people have their medications, they're more likely to take them. And if they're more likely to take them, they're more likely to be healthy. So if we break down those barriers to why people don't have their medications, we're going to have a healthier community. The other thing is, when I was in the traditional model, we kept using these brand name products, all the new stuff that was out. That's going to be bigger. It's going to be better. Of course, there's higher prices associated with that, right? Well, when I started this model, those essentially were not available to my clientele. I had very few people that could, get those because of their insurance models and their insurance plans. What I've learned is all of the old stuff still works. But what we need to do is coach people with their lifestyle and their behaviors and what their values are to help them let those medications work and work well so you can get to the goals that you want to, whether you're controlling your cholesterol, whether you're controlling your blood sugar, or your asthma. Again, the old stuff works, and I'm having people, controlled again when they weren't for years, and we don't have to use those big, bad, expensive medications.
Yeah, I one of the questions I was going to ask you is without getting to 2,500 plus patients, like how do you continue to grow your business, right? Um, so I love that, or I love to hear that you decided to have your own pharmacy as another, stream of revenue, albeit still reasonably priced. And it reminded me, so the only vaccine we've given her is vitamin K, but we through online research and whatnot, we found Bill's Pharmacy that's been around for like 70 years. That was like no preservatives, aluminum, like it was like the cleanest form possible, and the hospital wouldn't give it to her, so we had her pediatrician give it to her, a day after she was born, at the house, or 2 days after she was born at the house. But I just find it funny that it wasn't Publix or CVS or Walgreens. It was good old Bill's Pharmacy.
Right. Yeah.
God bless you, Bill.
Right. Exactly. And I partnered with a local pharmacy for the exact same reason, who helps us with those types of things. It was funny when I met with the owner and we were negotiating. I could tell he was on board. And one last question he had, he said, "What's in it for you?" He was talking to me, right? What's in it for me if he agrees to do this? And I just said, the satisfaction that my patients are getting good care. I mean, there was no monetary gain in the agreement with him, just other than the fact that we would work collaboratively to help people out. So like,
That's yeah. And guess what? You will make money because of that. Because again, that's my whole thing in this business, and I know David's as well. Like I have people all the time, like you give away a lot of like your time, your energy, your knowledge, and people, it's like they're like, why aren't you charging for that? And maybe I should be, but at the end of the day, I'm like, because that's the reason I don't make outbound calls any longer. Right? That's the reason my phone rings. Like, just go provide value to somebody, and guess what? People generally will talk about you in a very positive way.
100%. You've probably
absolutely.
got more patience
I'll
because
guarantee
people
you
say
have,
like, oh,
yeah.
and this, set up as well, but then also that particular pharmacist, I'd be shocked if they haven't, sent people your way as well. If anything, he
Right.
feels guilty that you're not making a cut off all the people you're sending to him, because probably everyone that you work with that needs a prescription goes there.
Correct. Yes. Yeah.
So
Yep. Absolutely. Yeah. You
that,
don't have to monetize everything. You have to be generous. You have to give something to get something, right? And it
mhm.
usually just works itself out, in the end.
Do you see, because as you mentioned early on, you're at the forefront of this model, an early adopter. Do you see more and more people doing it? Like we had a podcast earlier today, and the topic came up, weirdly enough, kind of related to this, where a lot of younger people aren't, or they're going into the hospital system to start because they're in med school, they have a quarter million plus of student debt, they need that guaranteed paycheck to be able to pay that down. No one in med school, they don't teach business necessarily. So are you noticing that people that are kind of midway through their career are starting to take that leap of faith more and more?
Yes. This model is the fastest growing medical model in our country. Now, having said that, 1%, 10% return on 1% of the market is still pretty small, right?
Hmm.
But that's still the fastest growing,
We're
you
starting
know, bi-
somewhere.
right, fastest growing business model otherwise. The, the hospitals have certainly figured things out. I mean, so they're throwing stupid money at people to get them in to stay. And most people, as you know, from a marketing perspective, have their default, and the default is to do nothing but continue with what you are doing and not make any changes. So even the folks who say, I'm going to go in, I'm going to get my loans paid off, I'm going to make this good sign-on bonus and income guarantee, and in 5 years I'm going to switch and go do things. Very few of them actually do that, right? But this model now is being introduced and taught more at the medical school level so that the students know that there's an option out there. And I don't know how things work in your business, but the millennials have a different view of life than what we do, and they value work-life
Freedom,
balance,
flexibility. Yep.
flexibility, being able to come and go, and having control and ownership over their schedule. This model provides that for sure. Now you can't have it all for the minimum input, but you have the opportunity to be in control and do that. So we're seeing more and more younger folks climb in. I would say smaller mid-career people. I think the mid-career people are probably the ones who are most dedicated because they have a lot of runway left in their career. So they're going to make the investment and really make sure that this is a no-fail proposition. I'm in it to succeed. Um, but but we see the other group at the end of their career. They're like, I can't keep up with this pace. I can't keep charting for 3 hours every night. I can't see 25 or 30 people a day, but I still have something to give back, and I don't want to quit. I love my patients. I want to spend time with them. This is why I got into healthcare in the first place. I want to know their relationships, all the things we've talked about. So we're getting some of those adopters in it for them. This might be a segue to you, Landon. This is kind of their exit strategy, but it might
Yeah.
extend their career for 5, 10, 15 years because it
They don't
decreases
have
the
the burn
strain
rate.
on the system. It opens up opportunities, right? And then they're not necessarily in it for the financial gains and rewards, but they still need something to do. And when you invest your entire life and career into the practice of medicine, you don't have a whole lot of other hobbies or uh, you know entrepreneurial options for you know keeping your family going. So it creates an opportunity for that without, doing locum tenens or working ER shifts or,
Yeah, because that's just more chaos.
correct, correct. So there's kind of three modes of who's jumping in. Um, I think at this point, what we're seeing is it's the younger folks, it's the new grads that are really taking um, a likening to this, especially after they get out of residency, because residency is by far it is a traditional model. It's sponsored by the um, Center for Medicare Services. So that's the model. That's the way it works. And quite honestly, when I was in residency, my wheels were already spinning. Like something is wrong with this. I don't know what it is. I can't put my finger on it, but
I think there's a lot
it
of you
doesn't
out there
feel
that
right.
feel that. Yeah. I mean, just working across a lot of physician groups myself, and David maybe chime in on this as well. But I think there's a lot of you that know the system is broken. It's just they don't know what or how to go about fixing it. Because I think you're right. I mean, I think you have the one-off egotistical freaks that generally end up in probably orthopedics or oral surgery that are love the I'm going to be a doctor for the title and the paycheck. But I think the vast majority go into it because they genuinely want to have a career that involves helping people, servant mentality. And the conversations I have is, it just all the bureaucracy now, all of the billing and insurance bullshit you guys have to deal with. They're like, I don't get to do what I thought I was going to do when I set out to do this career.
Yeah,
And that
100%.
sucks.
Yeah, totally. Yeah. When you believe wholeheartedly you have a product or a treatment's going to work and you get a fax back from somebody sitting behind a desk who says it's not approved and I don't have an option for you, that doesn't
Yeah,
feel
deal
good.
with it.
Yes. Yes.
Jeez. What
So it's
with
frustrating for everybody.
yeah, for the before we start to wrap up, we didn't get into this, and I just thought about it as we were talking about other people, entering into this side of the industry. Um, how'd you grow from zero to 600 adults? I think you said 200 kids. Um, like, what are some things that you did that other folks entering into this space, can take a page out of your book, so to speak?
Yeah, that's a great question. I wish I had mastered that because as you know, all of our businesses are always in evolution and flux, right? There's churn all the time, and you have to maintain that churn or beat the churn. But I was very, very lucky because I was the first one in our state, so I got a lot of attention from TV and newspapers, and the local newspaper did an article on me in July of 2016. It went national. It was in San Francisco. It was in Washington, D.C. I was on talk show radio in Massachusetts. It just went crazy. I got by far the most attraction from that article by itself. And even today, when I have a new patient in the room, I asked them, "Well, how'd you hear about us?" And they said, "Oh, I read an article about 2 years ago about you." I'm like, "That's been 10 years now. You've been holding on for 10 years." Like, yeah, I was waiting for the right. Has it been 10 years? So
That's wild.
that by far, if you can get an opportunity to get an article from your local paper, that just transcended everything. And I got lucky that it hit the AP wires and went coast to coast. Um, but now that it's gaining more steam, I think the likelihood of that happening is going to be less and less, right? Because
But
it's
correct me if
it's
I'm
more.
wrong, Todd. Are you kind of capped now where you're? I mean, at some point in time, you do. I mean, it's got to be like my world where, like I've kind of got to be selective with how many seats are on my bus, right? Like I'm
Right.
thankful that, I've got a junior advisor that I'm able to kind of stick some stuff down to. But I mean, you've only got so much time and capacity still to keep providing this same quality of care. Otherwise, you're going to go back to the same BS you came from, right?
Correct. Yep. Yeah. And that is, a deal breaker. That is not an option. I'm not going back to that if
Yep.
I can help it. I mean, things have to be pretty bad for that to happen. So I do have to be true to myself. But we grow by adding on more providers, in the
That's
office.
what I was wondering. So you have started to bolt on some additional providers and go that
Yes.
route.
Yep.
So you're
Absolutely.
still in growth mode then and able to handle that.
Yes. Yep. Absolutely. Yep. That's exactly right.
Well, I think it's only going to continue to grow and get bigger. I mean, I know David and I are out. I tell everybody, I'm like, you still go to your doctor's office? What the hell's wrong with you?
Loser.
Yeah. They're like, what do you mean you don't? And I'm like, no, like a once a year for a badass body scan and a physical. And then outside of that, I'm not wasting my time doing that. They're like, oh, tell me more. Like my partner here, he goes to the
Right.
same concierge doc I have now. Like, yeah, several guys in my
Well,
office now are
Yeah.
using
even
it.
too, imagine going from the concierge model, which Landon, maybe you are experiencing this now, but with Tay, but I was going to my wife's OB appointments, and we'd have like a 9 a.m. appointment, and we're seeing it like 9:25, and we did that 3 times, and I'm like, excuse me, but like fuck this.
Yeah.
So we found a midwife that could do all the same stuff, all the same equipment. They brought it to your house. And I was like, yeah, I'll spend the extra money to do this. You show up on time. You're in our home. We don't have to drive to Tampa, make us wait. And then there would be, we'd have to go see, whatever, a nurse, then go back to the waiting room, and then go back and see the doctor, go back to the waiting room, and then go back to the, what do they call, phlebotomist for blood work. And I'm like, absolutely not. How much? How much for the midwife? Just come to the house. Like, it's once you experience it, you'll frankly, Todd, I feel like you could double your prices and 90% of people would stay because as soon as they experience the
Yeah,
alternative is,
you're
they'd
not
be
going
like, all
back.
right, yeah, I could never go back.
Yeah.
Yeah, I hear that a lot. And I think I hear it from both sides. I hear it from providers, physicians, mid-levels, and I hear it from the patients too. Um, yeah, because I'm getting those stories all the time, like, oh my goodness, my experience was so bad. I mean, the people were nice and I think I got good care, but the experience wasn't. So yeah,
You're
we're
exactly
trying to
right.
provide that
Yeah.
experience that no, this is a good thing. And it's okay to come see your doctor once a year.
Yeah.
And we might spend, half the time just catching up and the other half time, what's your healthcare agenda? Let's deal with it. Let's take care of things.
And Todd,
So
for people that don't know, just because I know with this our audience, we're probably going to have a lot of people that are curious to this. Walk us through kind of how the typical pricing model works. I assume it's similar to mine, where it's a monthly, just standing kind of fee,
right.
and it's not exuberant, right? Like I think mine's 200 or 250 a month, something like it's obviously not relevant enough that I remember exactly how much it is, right? But it's basically a retainer to have him on call. And then, yeah, my insurance still picks up my prescriptions or any major stuff that I would need. But again, most of the time he's like, no, don't run that through your insurance. Just tell him your testosterone stuff is through GoodRx. And then, like David said, it's $38 instead of 150,
Right. Right.
Is that how
Yeah.
you do your stuff as well?
Yeah. Yeah. We have different tiers based on ages. Um, yeah. And I know my prices are low and they're some of the lowest in the country, but the first
But as
tier
long as
for
it's
adults,
fair,
yeah,
yeah.
it's $57 a month for a young adult. Middle-aged adult bumps up to $82. And then once you're a senior citizens, it's 80 or it's 90 or $107.
Wow,
But
the
even
cost of
kids,
living in Nebraska is fairly low. I'm moving out.
I told you we'll welcome you anytime.
but a couple things. I was the first one, so I had to set prices that people would be willing to accept,
Take
right?
the risk.
Take the risk for sure. Um, I'm going to have a little bit higher panel to accommodate for that because there are other concierge and direct care people who double their prices but also cut their clientele in half. So they can do that too. They're being just way more selective than I am from that perspective. Um, and then kids, we just throw kids on because as a family practitioner, we like kids, we like families. But the most common question I have is, do you have a family plan? How much is it per family? And I said, you just pay for however many people in your family, but the kids are $17 a month. I mean, one visit a year, and you're money ahead compared to paying out of pocket with a high deductible plan or copay anywhere else.
Absolutely.
Yeah.
Yeah, I think
And then for your clients, Landon, we love taking care of businesses for the exact same reason because, healthcare is killing our small businesses.
You're damn
And
right it is.
I want to help them be successful. And if that means give them an opportunity for a healthy and attractive personal health benefit and take care of all their employees, we're 100% on board and want to help those folks out. And yeah, we have over 40 businesses signed up right now, and they're, the employees love it because the employer covers the cost. They just show up and get seen. And most of the time they'll pay for their meds and their labs, but they're walking out of the door, full office visit, 30 minutes of our time for like $23
Yeah, it's
because,
insane.
yeah.
And for
And
our
they're
listeners,
getting
again,
good care,
they're
and they're
getting
not,
great care. Yeah.
yeah, and they're not, sitting in the doctor's office all day. They come in, get seen, they're back to work. So their employer
Yep.
is happy with that too.
And for our listeners, Todd is not your just average physician. He is entrepreneurial spirited. I actually met him through, again, our good friend Aaron Newell, the gift that keeps on giving. And but they have an entrepreneurial masterminds group that gets together. And so, I think that it's very cool that you do surround yourself because, again, you have one foot in the physician space, but you have 2 feet in the business owner space, right? So you have to understand that side of things. And so I love your passion for business as well. That's obviously where my heart is as well. So I think it's cool that you're willing to do that and help these small business owners out because that's obviously where my heart lies as well.
Well, I
Absolutely.
agree,
It's
and
fun. It's fun to see people succeed.
your your nose isn't just in like medical books, but also in entrepreneurial books and personal development books. And one of the things we do is ask our guests about books that have had an impact on them. And I think both of these, Landon, if I'm not mistaken, have come up in the past, which, if you hear it again and you haven't yet scooped them up, like definitely do because we're having these people, share them time and time again.
And
But
these
the two
are these are
books,
two of your core books, is
yeah,
my opinion as an entrepreneur. If you haven't picked them up and read them, then yeah, you're missing out.
100%. So the books you chose, and just, sort of quickly, the impact that they've had on you, Todd, Good to Great and Traction.
Yeah, absolutely. And I'm fortunate that I have other people who've gone before me who recommended these books. And I'll tell you a quick story. So another business member in our community who has signed up his company, you know, came to me and just says, I have a passion for this business. It doesn't matter what my business is. It's just I want to see it grow and I want to help my people. And he said, this is the book that, finally lifted me to that level. And it was Good to Great by Jim Collins. And he came in for his appointment. He left and drove all the way back to give me a hard copy book of it, which means something, right?
Yeah.
A, the relationship, but B, he didn't just tell me, go to Amazon and download it or go to Barnes and Noble, but he brought it to my office and said, I want you to have this. And
So
so that
naturally, you're going to
resonated.
read it.
Right, exactly. Yeah, it wasn't just, the free, pass in the parking lot. And so I read it, and obviously, like you guys said, it made so much sense. There's more to the culture of the business and growing than just the nuts and bolts of, hey, I'm really good at what I do. I think I can make a business. It's you got to build the culture, and you gotta exude excellence every single day and portray that to your employees and demonstrate that to your clients, but always be open and honest and transparent. And another term that I learned not from this book, but um, unapologetic customer service. Just it doesn't mean they get everything they want all the time, but give them the service that they're looking for. Even if there's a way to say no,
Hmm.
you don't have to shrug your shoulders and walk away to do that. So, one of my other buddies who's in this entrepreneurial masterminds group, I was telling him this experience, and he just looked at me and says, Have you read Traction? And I'm like, no, what's Traction? He's like, he's been through this. He said, Good to Great gives you the concepts. Traction gives you the how to.
That's the roadmap.
Like, yeah, exactly. So again, I'm like you. I've probably read that book, 8 times, not cover to cover, but in sections, what's important today. And going through that, now when I give presentations to the public, I always start with, what's my vision, what's my mission, what are my core values, And everyone who knows leans over and says, "Is this EOS?"
Yep.
Because they've read the book and they understand the concept. But when they see it up on the board, they're like, "Oh, I got to do that. I've read about it, but it's painful. I don't want to." But again, that is one of those key differences. You have to go through that exercise to get to that next level. And now you can demonstrate to your not just your clients, but your own um, employees. This is what we believe in, and this is where we're going, and this is why. Again, the why is always the most important. And it's not just have a paycheck at the end of the day. It's not just so we can have a nice vacation in the springtime. It's no, we have a burning purpose that we're trying to do every patient one person at a time.
I always say the why is the reason you get your ass out of bed when there's a foot of snow on the ground and still try and make it to your customers or your patients.
Correct.
Right.
Yep. Yep.
Spot on.
Exactly.
Well,
Exactly. And you've probably learned you got to ask your why 5 times. Your first answer isn't the right one.
yep.
No,
You're
I've said
repeating.
it literally will take us, when I'm facilitating a strategic planning meeting with my business owners, it's typically a 6-month process, right? Where I'm in there every other week, 4 hours, in an afternoon. And I'm not shitting you. Sometimes it takes us the first 2 months to get through their mission, vision, values.
Totally. Totally.
But then when
Yeah.
you get there, it's like everybody in the room kind of gets chills and they're like, yep, that's it.
Right.
Yeah, you
Yeah.
know.
And now you're almost on cruise control, right?
Yep.
Because you've cut through the hard stuff and you know what your purpose and your goals are. So you can get to business and it's
Yeah.
easier.
Well, I'll have an owner that calls me and says, hey, we're thinking about doing this. It's like, does it fit in the mission, vision, values, and the strategic plan? Yeah. Okay. If it
Cool.
doesn't, it's just noise. No. We got to update the strategic plan. You got to tell me why, right?
Mhm.
Absolutely.
It's
Yeah.
having the roadmap.
Yeah. Totally. So yeah, I picked those books because I think those are great places to start. So I've read Jim Collins, you know, full panel of books now because that was just his springboard, taking him to Great to Last and BE 2.0, et cetera, and all the additional questions his first book left with. Um, but yeah, more personal development and growth and entrepreneurship for sure. Yeah, it's fun because the first part of my life, I was reading textbooks and Harrison's Principles of Internal Medicine. So
A little bit,
that'll put you to
Volunteer to
sleep
fall
pretty
asleep
quick.
less
too.
dry.
Yeah.
Um, well, that's awesome, and obviously Landon and I are believers in what you do because we work with folks just like you. So we appreciate you joining today, and because Landon and Aaron Newell as well have driven a lot of our guests. A lot of our guests are in Nebraska, which means a lot of our listeners are in Nebraska. So plug away. Where can people find you? Where can they learn more about how to work with you?
Yeah, I appreciate that. So Aaron is a great source. I should just give a plug to Aaron because
He's a connector.
he's a connector, he's a walking billboard, and he's not afraid to name drop and dish out business to anybody. So yeah, big shout out and appreciation to Aaron for sure. Um, Access Family Medicine is the name of our business. We're in on the east side of Lincoln at 81st and O Street. We have a website, accessfamilymedicine.com. It is built to answer all of your questions. So most people call and are kind of dipping their toes in and don't know quite what to ask or how it works. The website will tell you. But you're always welcome to email us info@accessdpc.com. And one of our staff will be happy to answer that question and
And he
and
does
fill you in
reserve the
on how it
right to
works.
raise rates in the future. This is 2025. We're doing this recording. So should he happen to hire a value growth advisor and some strategists, there might be, this is today's pricing, folks. So
That's funny.
That is the
Well,
hardest thing to do in a business, isn't it, Landon?
it is. It is. Well, one of your individuals in your group, we had a strategic discussion on, how to transfer his business. And there was a way there for him to pull a lever just because, some of the individuals in the organization didn't have the balance sheet there, right? And we ended up pulling a lever to increase some pricing to help offset the cost of the buy-in to the individuals. So yeah, it is, but I think there's always a fair number, right? And I would say yours are definitely beyond fair. From a consumer standpoint, I don't know what David pays, but like I said, I know mine's at least 200 a month, and that seems very fair to me. I didn't bat an eye at that, right? So,
Hmm.
and it doesn't have to be, like I never go back to clients. I'm like, well, it ends up being a hell of a lot more work. I don't go back and raise prices on them, right? But it's like on new stuff going forward, that's, you know, yeah, but it can be hard because again, you're not in the puppy mill business. So you get to know these people. So that also makes it a little harder for us that are in the relationship business.
Yeah.
Right. Exactly.
But Todd,
Well,
this has been great. Thank you for
yeah,
the time.
appreciate you.
I
Thanks for
appreciate the
joining.
time. Yeah. Thanks for connecting. Yeah. Anytime. If there's ever another segue or something to dive in, I'm happy to visit
And same on our end. If with
visit
anything we
about it.
can do to help, let us know. We're always love talking to good guys and gals out there. So holler at us if you need anything.
Will do. Yeah.
Love
Absolutely.
it.
Thank you.
Well, and everyone tuning in, appreciate your time and attention as always. And the baby successfully fell asleep after a bout of hiccups at the beginning. So let's see how long this lasts. But appreciate you guys, and we'll catch you on the next episode.
Whoa. Who knew I would make it this far? They hated, they never believe me. Yeah, I would never drop the ball. I know I make it look easy. Yeah, Mayweather with the defense. I don't care what a critic got to say. I got them picking up the pieces.